How
into
long do
the
you find
underlying
results?
tissue.
How long do you find the results last for this?
Well, I think anywhere typically upwards of 3 months would be good. I try to stage it in 3 sessions, so I just don't do too much and get them used to it. So I'm using a cannula here and I'm going under the orbicularis. And what I like to do with a filler, I would like to enhance the deep medial cheek fat. But when you've got the orbicularis retaining ligament here. But with this product, you also can go within the tear trough region itself. I still like, as good practice, to aspirate a little bit, and then just the product gives a very easy flow. And I sometimes combine it with, we were talking about also combination treatments. I like to combine it with RF microneedling. So you can also do RF microneedling with PRP. You can do RF microneedling with PRP and this. You can do RF microneedling with NCTF alone. You can use exosomes. I don't know what you like to do, Heidi. Probably you do everything.
Well, I don't use that. Personally, I was not using exosomes or this, but plenty of resurfacing and tightening.
Yeah.
And then HAs in minuscule amounts.
And what about PRP?
I was not a PRP girl.
No, okay. So,
And nothing bad, you know, we all decide what are the things that work on our practice, and my patients wanted to see things. I used PRP for hair,
yeah.
but am not a big, but preferred most hair
Can you
out.
look up for me, Melissa? So I think, yeah.
And I think your point is very well taken with even a lot of the low G prime HA gels, that they may look wonderful when you leave your office, but they often swell. So many of us, you know, when somebody's very young and they don't have a lot of other reasons for swelling, you can get away with it more. But I found, I don't know, Ali, your experience, but I have found that I started dissolving more HA than putting it in the tear troughs over time.
Oh yeah, exactly. And I think less is more, and definitely in that area. And it's something that attracts water. Of course, you know, you also have to, everything is also a patient selection. If you've got a heavy smoker with lymphatic drainage issues.
I'm sorry, we had lost you for a second. What were you saying? Who do you find it's useful for? This looks lovely. Now, will she swell much after this?
Well, she will swell a little bit, but she won't swell much. And I think the trick is just to also, so you see, this is sort of the boundary. So this is the inferior orbital rim, and this should be the orbicularis retaining ligament. Now, so where you get swelling sometimes is if you want to push this and really push this beyond the, really shove that over the ligament itself, just to get a little bit of an improvement of this, what I call sort of a drop-off, that can injure tiny vessels and give you some issues there.
Now, does this have lidocaine in it?
No.
And the patient, do you want to ask the patient how she looks very, very calm.
Well, I paid her. She's earning a fortune just to pretend that this goes well. Can I have the swab? No, actually it's not too bad, but the first initial bit that it goes in, you know, that's not very nice. So I didn't put much. See, that's
how much did you put in?
A little bit more than 1/2 ml.
And would you say that was, so you went to full correction or a little less than full correction?
Yeah, a little bit under, and if I consider her up, you can see there is already a bit improvement, right?
Mm-hmm. And if you're spacing out treatments, What's the frequency of treatments?
So the frequency of treatments is, I would say, I would do it, if you want to get really a good result quickly, I would do it, I usually bring them back, do bits and a little bit, and I bring them back every 2 to 3 weeks, and do more until they're satisfied. So
And then after that, you have to repeat it at 3 months?
it depends if they're heavy smokers, or some people don't come back because maybe they thought it was too expensive, but some people come back after 6 months, or some people come back earlier. But I think on average you can say it lasts about 4 months. But it really also improves the skin, and I think the skin changes that you can get with this is good. And I thought it was only because of the RF microneedling, but I think that the patients that have this combined with the RF microneedling have better results than the ones who have only RF microneedling with topical HA.
Now, if you're doing the either RF microneedling or other kinds of tightening or resurfacing, how would you do that first or after this? And would you do it, how much would you space apart the treatments?
Well, people want to do things at the same time, so I think you can do, if you want, you can do this, and you can do RF microneedling with topical at the same time, but then then I think you should warn them that they will get at least some downtime and swelling. So that's something to be.
And there's no problem with the RF impedance or anything with the
No.
with the fluid. Okay.
No, I wouldn't have thought so. No. But again, I don't have evidence-based. So you see, I just go back when I set her up. I just went back and I thought I wasn't happy, so I just went back and did more. So now I did a full ml, which I think if we set her up, now you see a better correction.
And did you say that that comes as a liquid?
It comes as a liquid.
And you
It's
don't have to
already
dilute
diluted.
it?
Sorry?
You don't dilute it in any way or reconstitute it?
No, you cannot. You do not have to dilute it. Now there have been papers that this stuff mixed with CAHA with radius gives. Can I have the other one? Gives good results or better results and longer lasting results than CAHA alone. Apparently that has been also published. I read a publication about that. Yeah, I'm not sure whether that's also been replicated by people who have virtually no interest in the company. But it is a very interesting phenomenon.
How much now, you said this is a combination of peptides and HA. Do you know how much HA is in it or what the percentage?
It says it on it, I think it's, can I have the box? It says it's 24. So what's the HA content exactly? Because they have got two kinds.
Okay.
They have NCTF without HA and they've got NCTF HA.
Got it. So versus PRP, would you say, how would you compare this result-wise to using PRP for this area?
It's got some it's got some non-cross-linked HA in it.
So you're going to get more hydration.
It gives more hydration and it gives more immediate
Results.
volumization.
Got it.
So this, can you read that up? So it's got 5 milligrams of non-cross-linked HA, and it's got a huge amount of 24 amino acids, 6 minerals, 5 nucleic acids, 6 coenzymes, and others.
And so, what are the amino acids, the everything else that's in there? What is that doing? Like, what is the purpose of those? Is that presumably
So I
collagen
think
stimulation?
so what the technology behind it wants us to believe, and I don't know how far we should go in that, is that essentially your fibroblasts who have to do all of the stuff become lazy or are sometimes lazy or born lazy. So this product should enhance the work of the fibroblasts and also help them produce more of the right type of collagen and also enhance the skin. Now, how that's supposed to be done scientifically, you shouldn't ask me because I don't know.
So presumably, this should be a skin surface enhancer. That result should last longer than the volume improvement.
Exactly.
Got it.
So, and now some patients come, they say, you know, it also improves the wrinkles. Now there are also doctors who add a little bit of toxin to this jungle juice. So I don't know how much, you know, what's doing what.
And then perhaps you don't want to put it everywhere you're putting it now for that.
Exactly.
Because you don't want
I
that to
would
spread
be
to the
I would be
zygomatic.
very careful with that.
Right.
Because that's going to be, you know,
Yeah,
that
you don't want to
can
get a
cause-
droop.
can cause problems. So
And
you see,
what
I'm doing
gauge-
it. It's
what-
very tedious for you probably
Yeah.
to watch, but I'm doing
No.
it very slowly because nothing would give some people more gratification than to see me having a very, very blue eye.
What size
And unless I
cannula?
won't like it.
Yeah. What size cannula are you using?
So I'm using a 25 gauge cannula, and I would even go bigger if you could. But I would not use a 27 gauge or a smaller
But you
cannula.
could
But
use
I
a
think
22.
22 or yeah, I think we all have 23, and I like the cannulas. We cannot, you know, the Seriglide type of cannula.
Yeah.
You can use whatever you want. So you see, I will not have a perfect correction here, so that's why she will have an improvement. I always tell them, you know, this is an improvement, and we can we have to err on the side of under correction, and then bring her back and do maybe a bit more.
And
if
where
necessary.
else on the face would you use this product?
Well, some people like to mix this with CAHA for hands. It has also been used for the intimal regions. Those are the regions which I do not professionally venture into, except in surgical ways. So yeah, those are the areas that can be enhanced. I think for biostimulation of the superficial layers, this works really well if you combine it with CAHA. So that's something that we could do. So can I just quickly, how much time do I have? Can I just quickly
I
move
see
that?
it says it's like a little under 8 minutes.
Okay, so I've got a bit more time and I can now
Treat
go.
another area.
We can go to the other area, and I really want to improve this
Yes.
area. So I'm going to take a more of a mid G prime filler. No, the other one, not the lips. That one. Can I have that one? So no, the black one. Yes. So
And,
what I'm
and will you be treating deep or superficial or a combination
where?
in this next area?
I'm going to, so very interesting about this area is that now if you look at the recent studies from Minelli, and we've been working with the Mendelssohn Maffack group, and what they found, and I think it's so fascinating that anatomy is an evolving concept, is that the DAO, sort of the mandibular ligament, it's not a true ligament. So it's a sort of a fold which folds over from the platysma and from the DAO itself. That forms the ligament, and we thought it was a true ligament, so which is apparently not. So when you do a deep plane facelift, you go deep, but to improve this area, you go superficial. And we're actually doing more or less the same, which what I call the violin technique, is not very kind to the patient because she won't like this, but very gently, we're just doing a more or less of a subcision or using the filler here as a spacer, but removing the dermis from the underlying DAO and also attenuating that little bit of the fold of the DAO, what we called as anatomists the mandibular ligament, and would give you that very strong marionette type of.
So you're getting rid of, basically, it's like the mattress, the pull that's causing the dimpling.
Exactly.
And it also explains why, as you say, the platysma is there. It explains why treating the platysma can also help the appearance of that, the DAO area.
Yes.
And I would agree, it's very interesting that when we used to treat this, this area, we would always go deep, but we can use less filler by using one of these so-called stretchier fillers and
Exactly.
going superficial. Remember, you don't want to use something too stiff superficially, or else it will look bulky when they smile.
Exactly, and I think some of that you definitely do not want to use too much, and definitely not a high G-prime filler in this area, because that will look very bulky.
Now, do you ever, as an entry point, instead of starting below, do you ever start lateral to the angle of the mouth and go down?
You mean here?
Yeah.
Yeah, sometimes
Yeah.
I do.
Because I know that for some patients, that's another option for people, depending on the shape of that volume loss.
Yeah, and I think here when you see my cannula going right under the modulus, and of
Yes.
course a lot of people are very experienced, but there are some novice injectors also there. That's where the money is. That you really can plump
Exactly.
up that area there and make your patient, give them a sort of a happy smile and make them come back.
Yeah, without it looking like a donut or a Joker
Exactly.
smile. Yeah, it's beautiful. Looks beautiful there.
So you see that she has had quite a bit of volume loss here, but there's also a school of thought of people now, they're doing only biostimulators, and they hope for the collagen to come back. Now, of course, there's also the combination of biostimulators with HA, which does not give you the dip. So there are many ways to skin a cat.
And the other thing is, there are people you do need, depending on the biostimulator, if it's something that only works by biostimulation without having any structure, if you have a lot of volume loss in that area, it's not going to help. So I think something like CAHA, if someone has a lot of volume loss with lax skin, may do more than PLLA, and I love PLLA also.
Do you really love PLLA?
I do really. I know you're a surgeon. We've had this discussion. PLLA.
But now I've got something to tell you, is that my hesitation about PLLA is going to go away, because in China, of all places, they are making PLLA with round spheres. I don't dislike the product as such, but the fact that it had sharp angles which elicit the wrong type of collagen, that's my issue with it. Now they're making PLLA with round spheres,
Well, I have
and I
to
think
say,
that's going to be a serious contender.
it
to
may
the
be, but it's
CAHA.
going to take a while for China to get it out and for me to use a product that's
Why? Because
potentially
you
from
work
China.
globally.
I do work globally, but I like to know that there's a lot of, I don't know how quick the FDA is going to approve it. If it comes out right, that's great. But I will say I have buckets of PLLA, the brand, what we have now, is what got my face back after sudden menopause with chemo at 43. So, because I needed pan volumization. But again, yes, I think having round would be nice, but we have to see the results. But that looks beautiful. I think everyone can see, despite some of the anesthetic on that side, how she's less indented there.
Okay, so I'll do the same on the other side. How long do I have?
Just about a minute and a half, little less than a minute and a half. Now, would you then be treating to blend it into the medial cheek, the outside of the, you focused on the pre-jowl sulcus. Would you be blending that in some way with the cheek area, or figure that she has very full cheeks and this will just elevate it?
Yeah, I think in her case I would not do it, but definitely I could. You could go all the way around, you do that.
And
She's
that's the
got
jawline, as you mentioned.
Quite good cheeks, so I wouldn't do that.
Right.
What you may have seen is that I have reinforced her chin, you know. So I've not only treated
Yes.
that area, but I've also reinforced her chin. I don't like to reinforce the chin too much because I think
You don't want to widen it.
Although, because what's her name? She's the Barbie girl, Margot Robbie. She has a lot of following and she's got very strong chin, so a lot of girls come and asking for it. But I don't think we should over masculinize the
Right.
chin.
She also has she has a narrow face otherwise, so it's a different look. But
Exactly.
that looks great. And I think a great point is if you did want to, you could even reach the center of the chin with a cannula there. And what cannula are you using?
Same 25.
25. And do you often use a 22 there also?
25 or 20. I think we've got 23. I think
23.
we usually don't use 22.
Yeah, I guess I didn't have 23s, but anyway, this looks fantastic. We are
I'm gonna
out of
sit her up
time.
in. Gonna sit her up in just a
Yep,
few
because we're
seconds,
waiting
and then
for
you can have a
you
little look.
because it looks wonderful.
So
And I
I
think
won't
the
have
other
time
thing
to show you, but what I will do off camera is for her, as we discussed, is her lips a little
Yes.
bit, juice those up.
But I think what's great that you showed, you didn't rush despite this being a demo, and how slowly he went through with these fine areas. You don't bulk it up quickly, and I
So
think
we can
that's
see
wonderful.
her here. You can see that's improved.
Yeah.
She may have some swelling here on
Yeah.
the lower part, but that will dissolve,
Bruising there.
and then she's going to have a better improvement of this area and that area as well. Sometimes when they have a bit of bruising here, also bring them back and do some IPL. So
Yeah, you can use a vascular or IPL 2 days later.
exactly.
PDL or IPL.
Okay, can we?
That looks wonderful. Thank you.
You're welcome.
That was great. Thank you,
Thank
Ali.
you so much.
Thank you to the
Bye-bye.
patient. Thank you to the patient. Thanks. Bye, all. Bye. Thank you.